Hey everybody, Dr. Rob Silverman. How are you? I hope you had a great weekend. Here in the office, sorry I'm a little late. Some patients, some things going on. Excited to be here and share some true updates. We've done a lot of conversations on COVID. We've done a lot of conversations on some other health elements. Something that's very unique and something that's very important to me, and I don't think enough docs talk about, is obesity's effect on joint failure and obesity's effect on tendon failure. So let's go through some quick structures. Tendons go from muscle to bone. So here's your bone and here's your muscle, and tendons attach. So the muscle becomes more thinner and attaches to the bone. This is one of the areas that we like to talk a lot about. Most people don't understand there's a direct correlation between your body weight, your body composition, and your musculoskeletal health. So when we use the term obesity, that was the term in the study. So obesity is about 35% body fat, which is substantial. Obviously, 35%, it may be 30 for men and 35% for women. Women have a little more inherent body fat. People who are corpulent run the risk of having more musculoskeletal injuries. So I want to go over a quote, and then I want to go over each individual stat. I see a couple of shout outs. Hey Jen, how are you? Great to see you. Going to give you a little like there. Christina Crawford, my pleasure. Hope all is well with everybody. Thanks for checking in. Thanks for supporting. Thanks for watching. Everybody, please like, click, share, make a comment, give me a shout out. Only too happy to help you. So obesity in this study, this is a study that just came out in April, is associated with a higher risk of tendinopathy. Tendinopathy, as the word says, pathology to the tendon. Tendon tears, that's obviously, so one thing, there's a difference between a tear and a torn and a rupture. So tear is, if I were to take a piece of paper like this is a tear. So understand that that is not it's still attached. This is a torn or a rupture. So it's a distinctive difference. This piece of paper will show it. Hey Alma, pleasure to see you. I'm going to hit you with a like right now. I'm having a blast with my laptop. In addition, obesity is associated with a higher risk of tendinopathy, tendon tear, and rupture, and complications after tendon surgery, more so than those who are non-obese. So obesity leads you down a path of tendon injury. It leads you down a path of tendon tear. It leads you down a path of tendon rupture. And if you have surgery, when you put people who are not obese versus people who are obese, the obese people had worse outcomes. And the question is why? Obesity means that you're basically inflamed. Most people don't understand that. Fat cells are depositories for toxins, and it's low-level inflammation going on in our fat cells. So you have this pool of inflammation. We always segue back to COVID. One of the biggest complications, one of the biggest reasons that you have comorbidities and complications is obesity. 75% of Americans are obese or overweight. 42% of people in America are obese. 29 states have an obesity rate of 50% or more. The other 21 states have an obesity rate of 35. We are an obese nation. We need to lose weight. We need to get better body composition. So let's take each stat one at a time. Medial epicondylitis. If you're obese, you have a 1.9 times incidence of medial epicondylitis. Medial epicondylitis is right over here. Here's your epicondyle. This is what they like to refer to as golfer's elbow. So when people come in and say, I need you to treat my golfer's elbow, I'm also going to look at their health status. And that's one of the biggest things you want to seek out in your manual therapist and your chiropractor. Are they looking just here? Because he who treats the site of pain is lost. You want to look at the whole body. That's what a holistic practitioner is supposed to do. So medial epicondylitis, yes, I would treat it. Yes, I would treat it with low-level laser. Yes, I would treat it with soft tissue release, instrument-assisted, exercise rehab. I would adjust the joints. I may look above and below. That's one of the biggest things also when you go to a manual therapist. Do they look at the joint? Do they look above and below? And they do look at the whole of you. That whole you is that obesity. You're inflamed. You're not going to respond to treatment as well if you're too inflamed. So again, I may say to somebody, I'm going to treat you here, but let's get you on a plan. And that plan may include a dietary changes. Again, as everybody knows, no gluten, no dairy, no processed food, no sugar. I may do a ketogenic diet. I may do a Mediterranean diet. I may do a modified elimination diet. So the instance 1.9 increase in medial epicondylitis, which we now commonly call golfer's elbow. Achilles tendinopathy. Now the Achilles tendon, I'm not going to be able to show it to you here. The Achilles tendon, everybody knows what that is. That's the area of the least amount of blood flow. Tendinopathy, so when you injure that takes a long time for it to heal. You have a 3.1 times increase incidence, almost 4 times. And the reason is, doesn't respond well, not a lot of blood flow. And when you think about it, the extra weight puts a lot of stress on the Achilles tendon. The Achilles tendon is made by 3 muscles in the calf, the gastrocnemius, the soleus, and the plantaris, if you have one. So it is what I like to refer to as a force or a stress disperser. So the heavier you are, the more stress on your feet, the more stress on your Achilles tendon. Patella tendinopathy. It's your knee bone, as most people like to refer to that. You have a 1.1 times incidence, once again, or increase if you're obese. Again, if you're obese, you have that issue with the stress at your knee cap. Plantar fasciitis, about 3 times the incidence of plantar fasciitis. Plantar fasciitis is very interesting. It's the heel pain, or most people refer to heel pain. So plantar fascia, without question, is a thick structure at the bottom of your foot. If this is my foot, there's I'll call this the lateral, and I'll call this the medial side. You have lateral medial plantar fasciitis. Plantar fasciitis is an extension of your Achilles tendon. So once again, it's a stress disperser. A lot of pressure in the plantar fascia region. A couple of the treatments that I found very effective for both Achilles tendon and especially plantar fasciitis has been low-level laser. So myocardial laser has an FDA clearance for plantar fasciitis, 6 visits, and a lot of Achilles tendon injuries are healed with low-level laser, in addition to nutritional support, and once again, getting the weight off. Rotator cuff tendon injury or tendinopathy, 1.25 times the increase. So rotator cuff's right over here, or here's your cuff, if you will, makes up 4 muscles: supraspinatus, infraspinatus, subscapularis, and infraspinatus. It is a dynamic compressor and rotator of the shoulder. So rotator cuff is a very interesting thing in that you get rotator cuff impingement. Here's your rotator cuff. Here's your arm bone or your humerus. You have in a perfectly positioned region, perfectly positioned joint, only about a 1/2 inch in what we call the this is your subacromial space. So any kind of pressure, any kind of extra weight causes what we call shoulder impingement. So if you have shoulder impingement, you get rotator cuff injury. If you get rotator cuff injury, you get shoulder impingement. Your rotator cuff and your shoulder are directly related to your scapular bone, which is back here, and it has a malposition. Weight, too much weight in your chest, too much weight in your back, will also malposition your scapula, leading you down a path of rotator cuff injury. Rotator cuff tear. So first you're going to get tendinopathy. You're going to get some inflammation and some small little fraying. Then you're going to get a little tear. That tear has increased its incidence in obesity to 2.35 times more incidence in rotator cuff tears if, again, you're obese. Rotator cuff rupture leading to tendon surgery, 3.5 times. So the weight poses an issue. But what's in the weight, the inflammatory markers, the inflammatory cytokines, the toxins, is what leading you down a path of damaging your tendons. And these tendons can ultimately lead to rupture, leading to surgery. So what do we do? Again, it's all about lifestyle. If anything in the media, anything about the idea of the virus, anything about health is, let's get everybody leaner. One of the biggest things that we found, that America is the leader in obesity. I would always thought that my country, where I live, where I've grown up, where I've lived my whole life, has been the leader in a multitude of things. We call ourselves the beacon of light. And I agree with that. But I think more so when we're in now the beacon of obesity, and we need to change that. We need to become a healthier country, maybe mentally, but clearly I'm talking about physically. One more thing came across. Somebody had asked me about melatonin. So I recommend a lot of melatonin. Melatonin was shown at 20 milligrams to help with what we call the cytokine storm. Melatonin works with the cytokine storm because it decreases your incidence of inflammation, and all your release of all your interleukins. It also decreases reactive oxygen species. And we all know that melatonin helps with sleep. So one of the new jams about melatonin is melatonin has had some good results with migraines. So here's a source, Headache, the Journal of Head and Face Pain, April 30th, 2020. Melatonin may be of potential benefit in the treatment prevention of migraines in adults. So for me, melatonin is one of my go-to nutrients. Did you have a question?
Yeah, you have a comment from Christy. She says, I'm 5'3", female. Would you gaining 120 pounds be good for me? Because right now I weigh about 108.
So Christy just asked a question. For whatever reason, it didn't come up. Let me circle down. Let's see if it came up and I can read it. Hey, Heather, how are you? That was my mistake. Thanks. So, hey, Heather, how are you? Thanks for listening. I appreciate it. Christy, how are you? You're 5'3", so would be. You mean go to 120 be good for me? Because right now you weigh about 108. So, Christy, I don't know where you are. If you let me know where you are, I would make a suggestion. It's not about your weight. It's about your body composition. It's not about your weight. It's about your gut health. It's not about your weight. It's about some genetic markers. So 5'3", 108 seems light, but you may be really healthy. And if it's 12 pounds of fat, I'm not going to go with that. So I need to know where you are, because if you're in the local area, I'd love you to come in. Well, how we determine people's body fat is an in-body. So anybody watching, so my front desk is watching right now, anybody watching, if you're in the tri-state area and you can come in, you can get a free in-body test. That in-body test will tell me your body fat, your visceral fat. Visceral fat is the most inflammatory fat, and I'm very happy to have you do that. Christy, let me know where you are. If you're not watching now, please give me a comment. And if anybody needs help with that, and as far as that, put your link in, and Stephanie from my office will get back to you. That's a great question. I don't think we have any more right now. I know it's a little late, guys, but it's been my pleasure. Hope to see you all soon. We'll see you tomorrow at 1 o'clock. Dr. Rob, always yours in health.